Christ is uniquely positioned. I would call us a gem in the Chicagoland area and really across the country. We're a 750-bed hospital labeled as community hospital, but we have large residency programs for many specialties.
First thing that jumped out at me was like how outgoing all the residents were and the faculty. Everyone was like saying hi to you in the hall, was super approachable, so it just kind of stood out to me right away.
I was looking for a place where the patient population were multi-diverse, so as me as an Hispanic, I was going to be able to provide like care and help these people and help the Latin American community.
So it was a few things. One reason was because it was a community program that had a lot of the resources that an academic center would have.
And out of all the programs that I interviewed, Christ was the largest program that I came across. It looked like they were taking care of a diverse patient population.
Interestingly, I never rotated here, but when I came on my interview, I was meeting different residents who were going here, a couple of residents who were on night shifts. They came downstairs, started greeting us, were actually like very happy. They were smiling, telling us about their experiences. And for me to see a person who worked all night and still come downstairs and talk to us, be happy about their experiences, that really showed me a lot about that program.
I believe that we stand out because our patients are very ethnically diverse as well as pathologically diverse.
The socioeconomic diversity, the racial diversity, it all just really fulfills the experience you have taking care of this patient population.
It's a level 1 trauma center, so we see our fair share of just about everything. Also kind of a tertiary referral center for a bunch of the advocate system.
Overall, the people are what makes coming to work the most fun. You get to learn together, you really have this kind of family mentality, and you kind of live and work together in a sense that you work day to day, and then you spend your kind of free time with each other outside of the hospital, and I think that's an awesome opportunity.
It's a very open environment. People are willing to give you a lot of freedom if you're willing to ask for it.
We have the simulation lab over here that was very harped on, especially this year with our chiefs, where they took the initiative in taking us down there and teaching us these procedures.
I feel that this program, in a sense, allows you to fully realize yourself. You have the support of so many people.
You have tons of people here that have come from different places of training. They've trained here and in different countries. So it's really nice to get unique perspectives. Every attending and every person that's trained in a different area brings a new perspective to you as a clinician, so you can learn from them. And then you've had a lot of people that have trained at Christ and have come back here, which I always think is like a good sign.
Definitely the ICU environment, just really high acuity. You get to do a lot of procedures. A lot of independence, but at the same time, a lot of guidance from the attending physicians.
So I think this program basically trains you well to stand out in the bigger world out there.
Looking back at it now, I'm so glad I ended up here, because now that I've gone through the training, there's so many things that I don't think I would have gotten anywhere else, in my opinion. One of the things is having the observation rotation that we have here. I have, talking to people, colleagues all across the country, and now applying for hospitalist jobs. We have a resident-run observation unit in our hospital, and it's one of the few, I think, in the country, if not the only, that has residents that run the observation unit. Observation medicine is a very up-and-coming thing in medicine right now.
I'll be doing a fellowship in infectious disease at the University of Minnesota next year. So I think this program has really prepared me well for that. I've been able to find a lot of good mentors, get involved in research.
So my career goals, I plan to be a hospitalist. So I feel like the program has really offered me the opportunity to practice in what a life of a hospitalist would be. So we have a silver rotation, which is essentially a hospitalist schedule.
You feel as if you're home, and you get to do whatever you want, and whatever specialty ambitions you have, you can pursue them without fear of failing.
I'm going around for a 4th lap. At Advocate Christ, I'll be chief next year. My future goals are to apply for gastroenterology. So that was an opportunity for an extra year to continue the research that I've been involved in, and then to augment some of the leadership skills I've learned.
We have over 600 students that rotate here every year, so it's awesome, and they're like from 3 or 4 different schools. So you have tons of students that you can teach. We have a unique rotation where you can serve as a DACR, which is sort of just a role where you're exclusively on the IM internal medicine floor service just to teach students. And then we have a medical education pathway too, where we do small group lectures on how to teach people in small groups, how to teach in large groups. We do other simulations like bedside ultrasound. We just got 2 butterflies here, so we're working on developing an ultrasound program. And for me, wanting to be an academic hospitalist, it's cool to learn that ultrasound where you can bring it to the bedside.
The faculty are very vested in the residents' learning. It's a very non-judgmental place. You could ask a lot of questions and people will give you the answers.
I'm basically on a phone call basis with all of them. They're very approachable, very friendly, incredibly knowledgeable. They've trained at some of the top institutions in the country, and we are privileged to be on the receiving end of when they disseminate that knowledge.
My favorite part, honestly, and it may sound cliche, or it's just my interaction with not only the residents but also the attendings, physicians, the consultants. They are always so willing to teach.
I feel that there's a very collegial environment. It is not as hierarchical as perhaps you might find at some other institutions. I think largely that's due to Dr. Chadaga and Dr. Krikorian, our APD and program director respectively, who set an amazing tone and are themselves very kind people.
Look at you, or I'm looking down. Okay, okay, I'm sorry. Okay, again
One more time.
I like the deep dish.
Oh, I eat every hour on the hour. I'd eat both. But thin crust, probably.
Yeah, so, and also the food. Food is amazing, too many places to eat.
I think I fell in love with deep dish once I moved to Chicago.
Yes. I'm just rambling. Sorry. Okay, let's try that again.
Deep dish, but I'd say Lumonati's is for sure the best deep dish.
What am I trying to even say?
That's a wrap.
Oh my gosh, that was awful. This is hard.